Good morning, Girl Scouts.
Good morning.
Rename myself. Remember your name to your unit number and your camp name if you have one. Marshy and Marshmallow, do you have Zachary? Do you have Dawn's early first aid kit to follow along with? Could you ask Dawn's early to grab the first aid kit from the trunk of the Carly?
Okay.
Yes,
Thank
I
you.
want everyone to make sure that they have their first aid kit with them.
You're on.
Miss Piggy, Marshy and Marshmallow's boxes in Canada, their first aid kit hasn't arrived yet. So they're going to be using Dawn's Early's first aid kit to follow along with. And it might have things that are a little bit different. But
Yeah, there's a lot of things in other first aid kits that aren't in the ones that we made.
yeah, so hopefully they won't be too distracting of like, oh, ours is different. But I just wanted to let you know that that might be what's happening.
Okay, thank you.
You're welcome. Okay. Pickle is a co-host. Miss Vicky is a co-host. Pants is a co-host. We have fun, really fun names. My name. Cora, what unit are you in? Are you in unit 1?
What?
Is Cora in unit 1?
I actually don't know.
Great, I'll go take a look. 2. Lauren's in unit 2. Ding dong, who could that be? Cora's in unit 1, perfect. We're getting it handled. Our A game is getting pretty good.
Yes, it is.
Oh, Mozart is here. Let's add Mozart as co-host.
We also have Phoebe and Bean on.
Phoebe and Bean. Oh,
Yes.
do you two get to be in your same bubble?
Yes. Bean went to Phoebe's house. Also, Bean, where's Tybalt? Right. So, Unit 2, we have Tybalt today. I forgot to
I'm really
mention that
excited.
earlier. Yeah.
That's not high enough. Is there a pillow somewhere?
We don't need to show Tybalt, but we can if we want to. Makes it fun.
Okay, for whoever is signed in as me, so Christine Olson, and can you please change your name? Who is this? Where did you go?
They left.
I
don't
think
see
it was
them at all.
Helen.
Helen signing in as me?
I see Helen as.
I see Helen as Helen now.
Okay,
It defaults to that. It did that yesterday.
that's so great. That's so fun to have all of this.
Yes, it is. It's in join. Yes, Brave Bear. I see you have your hand raised.
I wanted to say that it's funny because you're going to have to do some first aid on me real quick because I got happy about it, but I accidentally got a splinter. I have no idea how. But yeah.
Well, we do go over Splinters. Stuff.
What's wrong?
Unicorn queen with lollipops on top. What? I see your hand raised. What's up?
Can you use the first aid kit?
Yes, you can use the first aid kit. So these first aid kits are made with a few things that are in basic first aid kits. You can always add to them.
All right, are you ready to get started, Miss Piggy? Or do you want
I
to give
can
it
get
a minute?
started whenever.
All right, it's 11:04. Go ahead and get started. And you are now spotlit, so you should be the front of everyone's video.
All right, I'm gonna share my screen. I can't read this. All right, here we go. All right, so I am teaching you guys first aid, and
Can we take a first aid out?
all right. So I'm teaching you all first aid, and going through this, you will earn your brownie first aid badge.
Okay. Thank you.
All right, and can we please stay on mute because it makes it hard for me.
Yes.
Thank you. So the first thing is that I'm gonna go over the steps. So the first step is you're gonna find out how to get help from 911. You're gonna talk to someone who treats people who are injured. You're gonna make a first aid kit. I'm just gonna explain to you what I have in the first aid kit, and I want you guys to give me ideas of things that you could add also. You're gonna learn how to treat minor injuries, and you're gonna know how to prevent and treat outdoor injuries. So this badge helps you to know if someone is sick or hurt and how to help them. You will also find out what to do in an emergency from calling to 911 and using a first aid kit and knowing if you need to call 911 or not, and when something unexpected happens, you will be prepared. So the first thing is calling 911. You want to call 911 only if it's an emergency. An emergency is something that is unexpected and you need immediate medical attention and help is needed right away. I'm going to show you some pictures and you're going to decide if it's an emergency. If it is, I want you to hold up a pretend phone to your ear, but if it isn't, I want you to give me a thumbs up, okay? So, we're going to start. I'm going to show you the first picture.
Are you able to see all of them?
I can see some of them, yes. I can see them.
Because you can show a grid view, and you can have my grid view goes up to like nine kiddos, and then you can look at different pages. Do you know how to do that?
Mine goes up to 6.
Okay, great.
Actually, I can make it bigger though. Yeah, now I have
12 now. And there's a little arrow on the bottom that I can push back and forth so you can see one.
Yeah, I have like 12 now.
Great.
Also.
Great.
So I will use this. So the first emergency or non-emergency is that your sister fell roller skating and she skinned her knee. If it's an emergency, I want you to show me a telephone. If it's not, show me a thumbs up. That's right, it is not an emergency. Good job, everyone. Next is your grandma fell downstairs and does not respond when you ask her if she's okay. If it is an emergency, show me a phone. If it is not an emergency, show me a thumbs up. I see a lot of phones. That's right, it is an emergency. You will want to call 911 because she's not answering you. So you don't know if she's okay. All right. Next one. Your brother fell down at soccer practice and doesn't seem to be able to move his leg. If it is an emergency, give me a phone. If it's not an emergency, give me a thumbs up. So I want to see your opinion. Do you think it's an emergency or do you think it's not an emergency? I see. So I do see a mixture of both, which it is because you don't know.
Maybe a mom could take him to the hospital.
Maybe you will go to the doctor, but it is very you don't know because since he can't move his leg, but you don't know if it is because it's broken or sprained or not.
Definitely need the doctor.
But you will have to go to the doctor. So you could go to the doctor, but I'm not sure if you would call 911.
It depends on if your mom is there or.
It depends if your mom is there or if there is another adult nearby. All right. So this is for when you're calling 911. You're gonna call 911 when someone has passed out. Someone seems to have very, yeah, I'm trying to move it so I can see better. You're gonna call 911 when someone has passed out. If someone seems very sick and is having a hard time breathing, or their face turns blue, if someone is choking, or if they're having an anaphylactic allergic reaction. An anaphylactic is when your throat swells up. So one thing that you want to remember when calling 911 is you want to stay calm and speak very slowly and clearly. So I'm going to go to the next slide. So in this slide, it is what you do when you call 911. So I am going to ask for a little bit of help from Phoebe and Bean. I'm going to have you help me on this.
Okay.
So I'm going to pretend to be the operator, and I want Phoebe to read what you would say, and Bean, actually Bean, why don't you be the operator, and Phoebe, you read what you should say, and then I'll explain each thing as we go on.
Okay.
So go ahead and start.
911, what's your emergency?
My grandma fell down the stairs. She isn't responding.
So you're gonna tell the operator what happened, what is wrong, and who's hurt. If more than one person is hurt, you want to let them know how many people are hurt, need help. So the emergency is that grandma fell down the stairs. That's what happened. What's wrong is that she isn't responding and she is hurt. So that's what you would say. Okay, continue.
What's your name?
Phoebe Buffet.
You would give the operator your full name.
What's
first
your
name
phone number? Sorry.
and your last name.
What's your phone number?
425-625-1987.
You're going to give the operator the phone number that you are calling from currently. All right.
Where are
Next.
you?
I'm at my house.
No, you.
You give the
7240.
address.
It says what you're supposed to say right there.
I know.
So on here,
We're on the park at Olympic Street by the stage.
so this is in Arlington, in downtown. So you would give the operator the address of where you are. So if you don't know where you are, you give landmarks. So an example, so in this scenario, the landmarks is that we're the park on Olympic Street and that they're by the stage. All right, continue.
Okay. What happened?
My grandma fell down the stairs. She isn't moving or talking. My mom can't find the pulse, and she has started CPR.
So you're going to answer all the operator's questions the best you can and be honest. If you don't know the answer, it's okay, and answer what you do know. You want to tell the operator if anyone has already given CPR, has given first aid, and what they have done. So in this scenario, the mom can't find a pulse and she started CPR so that they can restart the heart. And you do not want to hang up until the operator tells you that it is okay to hang up. You want to stay on the line for as long as possible so that you can get help. All right, so next thing is I want you to practice calling 911. Don't actually hit the buttons to call 911 though. We don't want that to happen at all, so please do not do that. And you can take a picture or a video of you doing that and you can post it in our Girl Scout Together photo book album. But it is required for the badge, so I want to see a photo or a video of everyone doing that, please. So you can get the badge and it would be awesome. All right, so, but make sure you do not hit call. I want to emphasize that. Do not hit call.
Can make up their own injuries.
And you can make up your own injuries. You can say whatever you want. All right, so this is step 2 of the badge. And we're gonna talk with someone who treats injured people. So in this video, you will hear from doctors in the Seattle area who treat people at Children's Hospital. So I am going to show you the video.
We interrupt our regularly scheduled program so that we may bring you a Como 4 special presentation when it's an emergency. Stories from inside the Seattle Children's Emergency Room.
It's always open, always ready.
You don't know what's going to come in. You don't know how families are going to be.
Here's having a
Can everyone hear this?
Yes, I'm able to.
Wait, you can hear it?
I can.
I was just checking. All right. I'm going to continue the video
A
now.
lot of distress breathing. 24/7, 365 days of the year.
So there was like a lot of blood, and so I just called 911.
The emergency room at Seattle Children's sees it all.
It's hard to see kids who are sick or hurt.
From heartbreak to hope.
Everybody always says, I just looked away for a second.
We take an inside look at the triage, the training, and the typical.
I felt it kind of bend, so I knew it wasn't good.
When it's an emergency, stories from inside Seattle Children's ER. Good evening, I'm Molly Shen. Here we are at one of the best places you never want to go, the emergency department at Seattle Children's. It's where you'll find world-class pediatric emergency care you hope your child never needs. But plenty do need to come here. This ER had almost 40,000 visits last year. Tonight, we take you inside to see the inner workings of the emergency room of Seattle Children's. Inside doors that never close and never turn away a patient. If there's such a thing as a typical day at the emergency department here at Seattle Children's, it usually involves some ambulance arrivals. Sometimes even a helicopter will deliver a critical case, like this tiny baby with big medical concerns. But no matter what comes in the door on any given day, the people who work here work very hard to keep this place from feeling like a primetime TV drama.
In order for us to provide the best care and the safest care and very detail-oriented care and mistake-free care, The best environment to do that in is not an environment where everyone's shouting out orders and running around. It's one of as much control as possible. We drill often. We want people to be practiced. We want people to be just going to listen to you, okay? Very attentive to detail and not distracted. And we want the family experience to be positive too.
Clinical Director of Emergency Services, Dr. Russell Magida, knows families who are here appreciate that environment in the midst of their personal crisis.
She had an event where she was submerged underwater.
The family of 5-year-old Alina Jennings will remember this day for the rest of their lives, the day they could have lost their little girl in a swimming pool in the blink of an eye.
Got her out in about 20 or 30 seconds, but she's been having difficulty breathing. She swallowed some water and vomited up some water. And that can lead to some difficulties, especially within the first 12 hours.
While emergency providers work with Alina, you can see the stress on her family.
It's pretty scary. She's going to go to our intensive care unit, and hopefully, and I believe that she'll probably keep breathing on her own, but she may need some assistance.
The patient and family experience is front of mind here every day.
They're looking just to make sure her blood gases stay good and that her lungs are good and that she's breathing okay and she doesn't go into respiratory distress.
Cases like Alina's show that you never know what the day or night may bring.
It's stressful and it's hard. It's hard to see kids who are sick or hurt, but we also know that it happens. And so the people who are here because they want to make a difference. And people who are here accept the fact that part of making that difference and being involved is dealing with the fact that sometimes there are very tough situations to deal with.
Oscar is just 2 days old.
He looks really, really good. He definitely is breathing fast, but he's not breathing with work. He's not working to breathe.
He's his mother's 3rd child, and her instincts told her his breathing didn't seem right.
Here you go, buddy. Here you go, Oscar.
And she thought she should have him checked.
He was having a lot of distress breathing.
Grandma agreed.
Right?
Well, I felt that Children's Hospital was the best place to go to make sure my little grandson was taken care of properly.
Oscar gets a thorough exam, including a chest x-ray, so doctors can find out what's going on with his breathing, from tiny newborns to teenagers.
I felt it kind of bend, so it wasn't good.
A broken bone, a painful abscess that'll need to be drained, an asthma attack. All kinds of conditions and concerns bring worried families through the ER doors.
Let's look at his palms now and soles, because I know he already has a rash, but he may actually get another rash with this rash that's in his throat.
I think that something that we have to continue to be mindful of is the fact that even for patients who don't seem like they're here for a critical issue, it's the most important thing to that family at that time.
The early diagnosis for Oscar is extra fluid on the lungs that didn't get fully squeezed out when he was born. That explains his rapid breathing, which is, of course, concerning, but not uncommon.
But this is a really savvy mom who did all the right things and saw all the things, watched for all the things that she needed to watch out for, and went to her primary care physician, and her primary care physician sent her here. So they have a good safety net, and the safety net worked for them. It's all serious to the people who are involved, but in the big spectrum of things, this is bread and butter pediatrics, and it's part of what we do, and it's part of what we enjoy doing. And the good thing about this is I think this is going to have a really happy ending.
Most children who come here do get a happy ending. Like Alina, who never stopped breathing on her own and now gets to move to a regular room for what will likely be a short stay. Mom pulled through too.
Oh my golly, I love this hospital. The staff is over the top, amazing.
It's another happy ending in a place where a typical day is anything but typical. It's true that those who work here never know what the day or night may bring, but they do know that they'll be working with children, from tiny newborns to growing teens. This ER and all the people who work here are uniquely equipped to deal with children.
It's broken.
5-year-old Abigail Nelson took a bad fall at her preschool playground and landed in the emergency department of Seattle Children's.
She managed to break both bones in her forearm, and the bones are broken enough and they're displaced enough that we're going to need to put the bones back into place so she can heal properly.
Her x-rays show she really did a number on that arm.
So these are the two bones of her forearm, her radius and her ulna, and you can see there's definitely a fracture right in the middle of the bone on both sides. This is why we always do 2 x-rays, because this x-ray, you can see there's a fracture, but it doesn't look too bad. When we look at the x-ray from the side, you can see what normally should be a straight bone is quite angulated. And this is the part that really needs to be fixed, is those bones need to be straightened so she can heal properly.
Fixing Abby's arm doesn't sound very fun.
One of the most important things is that we try to make this as the least amount of trauma and pain for Abby as possible. So we're going to give her some medications that will treat not only her pain, but will help her basically fall asleep while we get it done. She won't be completely asleep, it's not general anesthesia, but she won't have any memory about what's going on, and she won't really be aware of what's going on in the room. But the next thing is, it's a very safe medication.
To get that heavy sedation, Abby will need an IV. Also not fun for a 5-year-old.
Knock, knock. Hi, guys. Is this Abigail's room?
Enter Paul Foster.
My name is Paul, and I'm our child life specialist that works here at the hospital. So I'm different than our nurses and doctors, okay? So my job here at the hospital is I help you understand what's going on and then try to make it a little easier and more fun. Does that sound okay?
Paul prepares Abby for what she can expect in a way that she can understand.
I'm here to help make their stay a lot easier. My job is to help assess how kids are coping with their emergency department stay. And I provide preparation, education, and for our younger kids, lots of distraction to help get them through certain invasive procedures. How's he been doing so far since you got in? Did he do okay in triage?
Paul is a child life specialist. All of the providers here are trained in dealing specifically with children, using comfort and distraction techniques that are appropriate to a child's age and situation. But Paul is the big gun called in when a patient needs that extra special touch.
So this is the small straw. You want to feel it? It's really soft. So Mom and Dad, this is an IV if you guys haven't seen one before. So what we do is we put the small straw inside one of our body's blue lines, and we can give you medicine through it, and it makes you feel all better. And it's going to help take away the owies in your arm.
He doesn't hide anything from the kids. Rather, he educates them on what's about to happen and why in an age-appropriate way.
So sometimes kids ask me, they say, Paul, what is this small straw going to feel like? Do you want to know what it feels like? Yeah. Kids tell me that it feels like a small pinch. I love the educational component. I love getting to educate kids about why they come to the hospital and what the staff are doing. Because, for a lot of people, seeing the white coat come into a room is kind of a scary thing. But, knowing that all the doctors and nurses here really love to help kids get feeling better and to educate them on, why we do a blood pressure cuff and why we take their temperature and all those things. I like seeing that click in the child's eye of, oh, that's why they're doing that. And I really enjoy that. And you watch with your eyes and see if we find it.
Paul also uses distraction to help young patients through a procedure.
Is that the one?
Instead of Abby focusing on that IV about to go in, she's turned away, engrossed in a book that Paul brought. A broken bone, an IV. This is pretty typical stuff here in the ER, but it's a very big deal for Abby and her family.
A yellow frog. Okay.
Abby, being 5, it's important that I meet her where she is developmentally, understanding that she's not an adult and she doesn't necessarily want to know everything, but she wants to know everything that's important to her. So understanding what it is a 5-year-old understands and what it is a 5-year-old wants to know, at the same time providing an appropriate level of information for the parents who of course want to know everything. I want to make this for Abby, like I said, she's had a bad day. I want her to leave this experience with not only without trauma, but hopefully with a smile.
We're gonna give it to you right through your small straw, okay? So there's no more owies?
And it won't hurt when it goes soon.
Nope. Sometimes kids say that it feels a little warm, but no owies. Okay, and then you'll wake up and your arm will be all fixed. And you get to go home.
But when I'm asleep, I can't talk.
That's right. And you won't feel anything.
Yeah.
Yeah, it was. It was really scary. It was. Huh. The tumble 3-year-old Peyton took while vacationing in Seattle certainly scared her and her parents. My daughter had a fall over at the Science Center into an open, what used to be, it looked like a little pond, and fell over the chain wall and hit her, busted her head. But the time in the emergency room, even the stitches, really weren't so bad. They brought in Paul, who helped her just kind of ease and made her laugh, and brought in bubbles and books and coloring and everything. So she was much more comfortable with that part of it. And then he came in and talked to Peyton and explained to her the process of what they were going to do, and so she could understand. An ER visit as a child can set a lifetime attitude toward all things medical, good or bad. If this is a traumatic experience, patients could fear doctors, hospitals, even needles well into adulthood. Those who work here in the emergency department know the importance of making this experience as painless and positive as possible.
Are you still whispering? Yeah. Well, awesome. She did a great job, tolerated everything great.
Yeah.
So in terms of giving you advice for what to talk to her about at home, I can't think of anything because she did so well.
Okay.
So, but if questions do arise, usually she'll kind of express it through play. So just kind of keep an eye out through that.
We try to have a pain-free environment, so we always want to make sure patients don't have pain, but we recognize that a lot of the sense of pain is anxiety. And if we have people who are specially trained to reduce the anxiety, as are our physicians, our nurses, especially our child life specialists, it makes a huge difference for the family that children leave smiling and happy even after an invasive procedure.
Abby is waking up to an arm that's put back together so it can heal.
The doctors fixed your arm. It's all better now.
She's now excited about a pretty pink cast in her future and not at all upset by the day's events.
Bye, guys. Take care.
And Peyton heads home with some souvenir stitches and a smile. Paul isn't the only child life specialist here at Children's. While he works in the ER, other child life specialists in other parts of the hospital help kids deal with surgery, cancer treatment, and hospitalization. Coming up, the top reasons for emergency room visits here at Seattle Children's. Can you guess what's number one? And how prevention can be the best medicine. What doctors are doing to keep you from having to come here in the first place.
All right, so that is a lot of information, but it is also a lot of very good information to know. And it's step 2 in our badge. So I'm gonna go to the next one. So now I'm gonna talk about our first aid kits. So I have my first aid kit with me. So it is in a bright green bag like this. And I'm going to tell you what is in it. And I want you guys, when we're done, we're going to talk about all of the things in it, if we should add anything. And I see that Toko raised her hand. So I am going to, let's see.
I can ask her.
So Toko, what is your question?
I don't have a question. I wanted to share that I got my tonsils out once.
Okay. Well,
she was nervous about sharing, but she wanted to say that she met a child life specialist and they let her pick what flavor went inside the mask that she had to put on, and they gave her like a Power Wheels car to drive to the operating room.
That sounds so much fun. Is there any questions that people have? You can raise your hand and I'll go through. Percy Cats, do you have a question?
Can we open the green bag?
Yes, you can open the bag so you know what I'm talking about when I show you everything.
Okay.
All right, is there any other questions that anyone has? Pooh Bear, do you have a question? I see your hands raised.
So isn't like there's a stick kind of that?
Can you say that again?
So in the green, so there's a green bag, then there's a stuff, then there's another green bag.
Yes, so there's a smaller green bag inside the big green bag. There's 2 green bags. So I'm going to tell you what's in the bag, and it's in a bright green, it's in a bright packaging so that if you go backpacking, you can put it in your backpack, and when you go camping, you can have it with you. So I'm going to move on to the next slide so that you can see everything. And I'm going to tell you what we have in our bag. So we're going to start with having our big green bag. And if you open it up, you will see a small green bag. You will see gloves. This is an ACE bandage. And you will see an instant ice pack. But don't activate it because then it won't work anymore. So if you open your smaller green bag, you are going to see 3 big Band-Aids. You will see 4 small Band-Aids. You will see 2 first aid antibiotics. It's an ointment. You will see a towelette, an antiseptic towelette, and you will have gauze. And you also have a pair of tweezers. So another thing is that you should have gotten a piece of paper in your box. And on this paper, it provides information about first aid and different things in it. It tells you about CPR, what to do if there's major bleeding, about doing what you do for burns and heat stroke and shock and choking and hypothermia. And it tells you a lot of very easy things. So it's a good idea to fold it up and you can put it in your bag.
The little green bag.
All right, and also you should write down. You should write down some. This is a very important thing that you need to do. Is you should get a piece of paper and write down emergency contact information and allergies for each member of your family. Like an example that I could have is Pickle, who is my mom. She is allergic to bees and she goes into anaphylactic shock. So that is something that I would write down as an allergy. She is also allergic to cats. So that's another allergy that I would write down for her. But for me, I don't have any allergies. So I wouldn't have to write any.
I don't know.
Except I'm not able to have Tylenol, but that's not really a thing I'm going to talk about. So there's also other things that you can add to your first aid kit at home that I did not put in, like adhesive tape or a thermometer or safety pins or a triangle bandage or an emergency blanket, or a pair of scissors. But those are things that you could also add. So I want you guys to come up with one thing that you think you could add to your first aid kit. And I'm going to type it in the chat. And I want you guys to type it in the chat. So type it in the chat what it is. Pickle said burnt cream. And that is a very good moleskin.
Put on blisters.
And that's something you can use for blisters. Does anyone have any other ideas? Go ahead and type it into the chat. Or you can, a large square bandage. That is another good thing. There are many sizes of bandages. Ointment and lotion. First, do you have an idea? I keep seeing your hand raised.
Excuse me, Miss Piggy?
Yes?
I don't know how to type it into the chat, but I want you to say you should always have that water in a little bag. Extra
Water in a
water.
little bag? That is a good thing because you use
Yeah, clean water's good.
it is used for it is a good thing to always have that. For cleaning wounds. You could have Neosporin and aloe vera. Having a bandana is also a good idea because if someone hurts their arm, you can help them and you can tie it. That's also what a triangle bandage is for. It's for making a sling. So, Purse, did you have an idea?
Mrs. Kiki?
Yes. I see that Hershey wrote mask. That is a very important thing for right now.
It looks like Percy's might have.
When it's going to open the
I'm having a hard time hearing you, Percy.
Percy, can you find a grown-up to help you write it in the chat room? The reception was a little weird and we couldn't quite understand what you were saying.
Yeah.
It was like it was a little frozen.
Mm-hmm.
Ooh, there's some more suggestions.
Phoebe and Bean said a tourniquet. That's a very good.
When there's a lot of bleeding.
That is what you use for if there is a lot of bleeding. And it is, and you can't stop. And you put tourniquet above.
Yeah, I can do it like that.
I think that you put it you either put it below or above. I don't remember right now. I haven't. I think we will talk about that in later. So
Can I tell you about the tourniquets?
Yes.
How to use them? So you put it above the wound and then you tie it really tight so it'll stop the bleeding for.
But you want to
some
make
period
sure
of
that
time.
it also isn't too tight that it hurts the person.
Yeah.
Yeah.
All right. Thank you for that information because I was trying to remember where it went.
You're welcome.
All right, so we're gonna move on to the next slide. All right, so this is first aid kit information. You should know where your first aid kit is at your house and when you need to pack it with you. You want to make sure that family members and Girl Scout friends know where it is in case you are the one that gets hurt. You also want to make sure your first aid supplies are in the packet, to keep them in the packaging and to keep it zipped shut because these packages are waterproof. But if you don't want to keep it in the in the packaging that I provided for you. You could also put it in something else, but you should make sure that it is waterproof. And you should always restock the items that you use and check what is needed in before you go somewhere. And if you put medicine in the first aid kit, check the dates for the expiration, so you don't, because you don't want to use expired medicine. All right, so the next thing is I'm going to show you videos of how to treat some minor injuries. So here we go. We're going to start with how to treat cuts and places. And I'm going to hold up what you would use.
Cuts and grazes are common injuries that can usually be treated at home. A cut is a full break to the skin, whereas a graze is just the top layers of skin being scraped off. Normally, all you need to do is clean and dry the cut, apply some pressure and raise the injury. This should help prevent infection and stop bleeding. The wound should heal by itself within a few days. When treating the cuts, always wear gloves if you have them, and first ask the casualty to apply some pressure to the wound using a piece of gauze. Pressure on there, and then raise the injury. Next, you need to clean the wound.
You use an antiseptic towel.
And gently dry it. And finally, apply a sterile dressing.
You would use one of your Band-Aids. And the size depends on how big it is.
Remember, apply pressure, raise the injury, clean and dry the cut, apply a sterile dressing. If you're worried about infection, ask the casualty to seek medical advice. And that's how we treat a cut or a graze.
All right. So that is what you would do for that. Next thing is what you would do for bumps and bruises.
After an injury, it is common for somebody to get a bump or a bruise. Bumps and bruises may not appear straight away, but the skin can still feel painful, swollen, and tender. Bumps are swellings under the surface of the skin caused by fluid, and bruises are purple or bluish patches caused by tiny blood vessels that burst into the soft tissue. Bruises usually change to a greenish or yellowish colour as they heal. To treat a bump or a bruise, you need to apply something cold to the skin. Can you just hold that on there for me? This will reduce the pain and help it to heal. If you haven't got an ice pack, you could use frozen peas or ice wrapped up in a cloth. But remember, don't leave it on for any longer than 10 minutes. If the bump or bruise is very painful, then ask the casualty to lie down and raise the injury above the level of their heart. This will reduce the swelling. If the bump or bruise becomes very painful or very swollen, then seek medical advice or go to hospital.
And I can tell you, getting a bruise hurts a lot. Next is sprains and strains.
Strains and sprains are common injuries that affect the soft tissues from a joint. A sprain is when a ligament has twisted or torn, while a strain is when the muscle has been overstretched, and a rupture is when a muscle or a tendon is completely torn. There are three things you should look for: pain and tenderness, difficulty moving, swelling, and bruising. If someone has a sprain or strain, you should remember RICE, which stands for rest, ice, comfortable support, and elevation. If someone has a strain or sprain, help them to sit or lie down and support the limb in a comfortable position. To cool the area, apply a cold compress like an ice pack, cold pad, or frozen peas wrapped in a towel. Leave the ice pack or cold pad in place, or wrap a soft layer of padding like cotton wool around the area. Then tie a support bandage around the area to hold it in place. This needs to go up as far as the next joint on each side. Raise the injured area and support it with something soft like a cushion, or in this case, you can use a sling. If the pain is severe or they can't use their limb, they will need to go to hospital. Otherwise, just tell them to rest it and to seek a healthcare professional if necessary. So remember, when caring for someone with a sprain or strain, rest the affected area. Ice will help cool the injury down, give them comfortable support with bandages and padding, keep the affected area elevated, and that's how you treat sprains and strains.
All right, so in our packs, I gave you an ACE bandage, which is a thing that you could use for wrapping the injury. So that is how you would treat cuts and grazes, bumps and bruises, and sprains and strains. Next. So in the minor, for the next thing, we're going to talk about what you would use for the first aid kit. You might not have everything. So if you don't have something you're probably going to want to add it to your first aid kit. So for scrapes and cuts, what would you use? And show it into the camera. The first thing that you use is your gloves. All right, you would use your gloves. Next, you would use gauze to hold pressure on it. Next, you're going to take an antiseptic towelette so that you can clean the blood off. And then you would use a Band-Aid to, yeah, that's what you would do. Next is for burns or scalds. So yeah, so it says on the paper what you would do. So on the paper, it says to call 911. It says do not remove the clothing if there's clothing on it. Do not immerse in cold water. You should begin CPR if it is needed, and to elevate the burned parts of the body above the heart if it's possible. So if you burn a part of your leg, then you would lay down and elevate your leg up.
What if it's not a severe burn?
But if it is not a severe burn, you just use cool water for a bit.
And then drape it with a
And then you would drape it
loose bandage.
with a loose bandage. So the next thing is insect or animal bites. So for that, you could possibly, for an insect, if you get a bee sting, you would use your tweezers to get the stinger out. And then you could also use some
Add lotion for if it's
lotion or some Neosporin? No. Yeah. So minor allergic reactions.
ice pack.
You could use an ice pack. You could use.
You could add Benadryl.
You could add some medicine to take for that. There are so many things that you could do. All right. And for slivers or splinters, you use the tweezers to get it out.
Maybe ice pack.
And you might use an ice pack or something as well. All right, so for outdoor injuries, there are a bunch of different outdoor injuries like bug bites, bee stings, you can get a sunburn. There's also poison oak and ivy, and heat cramps. So I'm now going to tell you different ways that you can prevent these. You can wear bug spray to prevent getting bug bites from mosquitoes. And you can not touch the plants that are poison oak and poison ivy so that you don't end up getting a rash. You should always wear sunscreen if the sun is out, and you should reapply often. A good way to remember to reapply is to do it every time you eat. So you can, every time you eat a snack or you have lunch, you should put your sunscreen on. You should also bring a water bottle and drink your water and refill it to prevent getting dehydrated and any heat-related illnesses like heat cramps, heat exhaustion, and heat stroke. And you should always dress for the activity you're doing and make sure you're wearing proper shoes. So if you're hiking, you want to make sure you're wearing good walking shoes. Also, all right, next slide. So these are different ways that you can treat outdoor injuries. The first one is getting a splinter. All right. We're gonna go to our next video.
Miss Piggy, it looks like Brave Bear has a question, and Percy might have a question. I'm not entirely sure.
Okay.
So my question was, well, I didn't really have a question. I was going to say that one time I was riding my bike and I know exactly how I accidentally drove myself into a rose bush. So, you know, when you get paranoid and nervous and scared, you kind of stop thinking properly. So what happened was I accidentally tried to steer left away from the rose bush, but accidentally ended up veering left, not turning left, which just slid it under the rose bush more. And then I turned right into the rose bush. That was the problem. And here was Allie. It's basically fine now. This is the weird thing. I only got on my legs, and I only got one Allie on my left leg.
I'm glad that you survived. But I'm gonna move on to the next video, which is what to do with a mosquito bite itch.
Hi guys, I just got back from a really fun hike in the woods. I saw a lot of cool things like fall flowers and lots of birds and pretty rocks, but I only brought one thing back with me. Lots of mosquito bites. Depending on where you live and what time of year it is, if you spend time outside, you've probably been bitten by mosquitoes too. Long after the mosquito is gone, you're left with red, itchy bumps, and I mean itchy. So what's going on? Why are mosquito bites so itchy? To answer that question, we need to take a closer look at where these bumps come from. First, let's learn a little bit about the mosquito. For one thing, only female mosquitoes bite. And for another thing, what we call a bite isn't really a bite at all. It's more like a jab from a thing called a proboscis. Proboscis! Proboscis is such a fun word to say. A proboscis is a special mouth part that some insects have. It looks kind of like a long tube or a straw. If you've ever had the chance to get a close look at a butterfly, maybe you've seen their long curly proboscis, which they use as a long tube to sip nectar from flowers. But the female mosquito, she uses her proboscis to take a tiny sip of blood from the blood vessels right beneath your skin. Her body makes special chemicals to help her do the job. Some of them make your blood easier for her to drink. Others even help you from feeling the little pinch when her proboscis pokes you. After she's had her sip and she buzzes off, she leaves a little bit of those chemicals behind in your skin. and they set off signals in your body's immune system. Your immune system's job is to protect your body from invaders. Not ones from outer space, but invaders like bacteria and viruses. Any particles that can make you sick. Kind of like soldiers protecting a fort, your immune system attacks just about anything that it doesn't recognize. And that includes the chemicals left behind by the mosquito. Once your body discovers it's been bitten by a mosquito, it sends some extra blood and other fluids to the bite. This does a nice job of protecting the area so it can heal, and it helps your body get rid of the chemicals that the mosquito left behind. But it also makes the area around the bite swell up, causing a bump. And that swelling sets off nerves in your skin around the bump. Nerves carry messages between parts of your body. So when you feel the tingly itch of a mosquito bite, that's the work of your nerves telling your brain. In case you haven't noticed, there's something going on down here. And even though it's really hard, you shouldn't scratch those bumps. It's not good for your skin, and it actually makes everything worse. Scratching irritates your skin even more. And when that happens, your body's immune system tries even harder to stop whatever's bothering it. So that makes the bump even itchier. Experts say that using ice or a paste made from baking soda and water on a mosquito bite can actually help with the swelling and the itch. So remember, stop scratching, whatever it takes. Thanks for joining us on SciShow Kids. Do you have a question about bugs?
All right, so there are other things besides just the baking soda paste that you can use, and a lot of those things are really good things to put in your first aid kit. All right, we're gonna go over poison ivy.
It's finally summer. Squeaks and I are going to go outside as much as we can to play in the park and go for hikes in the woods. We love looking at all the trees, flowers, and plants. And we're not only looking at plants, we have to look out for some kinds of plants too. One of these plants is poison ivy. Poison ivy is a plant that grows in most of North America, especially in the United States and Canada. And for most people, touching poison ivy causes a rash that can be red, bumpy, and super itchy. That rash comes from a thick, sticky liquid that poison ivy plants make in their stems and leaves. But even though the name poison ivy has the word poison in it, it's not actually poisonous. Most people are just allergic to it. You might have heard of allergies before. Maybe you have a friend who's allergic to peanut butter, or maybe you have an allergy yourself. When someone has an allergy, that means their body reacts to whatever they're allergic to, which is called an allergen. The allergen might not normally be dangerous, but their body gets confused and thinks that it's dangerous and tries to fight it off. Lots of people can eat peanut butter and be totally fine, but in someone who's allergic, their body thinks peanut butter is dangerous, and that's why they have an allergic reaction. The same thing happens with poison ivy. The liquid in poison ivy stems and leaves has a special oily chemical in it that most people are allergic to. So if you touch poison ivy, your body thinks there's something dangerous on your skin and tries to destroy it. Your skin gets all red, and you might also end up with bumps or blisters, which are lumps filled with liquid, and these lumps itch. But if you do get a rash from poison ivy, try not to scratch it. Scratching can make the itching worse, and if your fingernails break the skin, germs can get into your body. Instead, you can use cool water or special lotions to keep the rash from itching while it heals. It usually takes 1 to 3 weeks to go away. Of course, the best way to avoid an itchy poison ivy rash is to avoid the poison ivy plant. So whether you're out in the woods or even just chasing a ball that rolled into the weeds, it's a good idea to keep an eye out for plants that look like poison ivy. Poison ivy looks like this for most of the year. Its leaves grow in groups. Let's count the number of leaves in each group. 1, 2, 3. Yep, poison ivy leaves grow in groups of 3. You can use this little rhyme to help you remember what poison ivy looks like. Leaves of 3, let it be. Now, not all plants that have leaves in groups of 3 are poison ivy, but if you're not sure, it's better to leave those alone too. In the fall, the leaves on the poison ivy plant still grow in groups of 3, but they turn bright red. And like lots of other plants, poison ivy leaves fall to the ground in the winter. What's left behind is sometimes a vine that looks like this, thick and kind of hairy looking. Since the vine also makes that oil, you shouldn't touch it either. And if you do accidentally touch a poison ivy plant, you should wash your hands with hot, soapy water as soon as you can. And since the oil can get on anything else that touches the plant, like clothes, you should make sure to wash them too. Oh, and Even though animals don't get the rash, they can carry poison ivy oil on their fur. So it's a good idea to keep your pets away from poison ivy too. But there's no reason to let poison ivy stop you from getting outside this summer. Just keep your eyes open for those leaves of 3 and let them be. Thanks for joining us on SciShow Kid.
All right, so that is the ways that you would treat a splinter. You learn about mosquitoes and poison ivy. So remember,
Dinosaurs or anything else?
leaves are 3.
Let them be.
Let them be. And you guys have earned the badge
If they do the homework.
if you do the homework, which I'm going to show you right now. So your homework is to make a video or take a picture of you demonstrating how to call 911 and what to say when you call it, and to write down emergency contact information and medical information for each family member and put it into your first aid kit, and make a list of items or add items that you would need to put in your first aid kit. And I am going to stop sharing. All right. Does anyone have any questions?
I think that Toko has a keychain to share.
Oh yeah, I heard about that. So
I made
from Imagine Dragon.
keychain. It's not colorful because it's not sunny right in our house.
What happens when it goes outside in the sun?
But when it goes outside in the sun, it gets colorful. And then I know that I need to wear sunscreen.
I have that same type of bracelet.
that is very, very cool.
I also have another thing.
Because of the sun rays. I know why it color changes. It's because of the sun rays. Well, mine color changes because of the sun rays.
Yeah, when there's UVA and UVB lights. Go ahead, Toko, you had something else to share?
So I also have this. It's for bug bites. And you push this on wherever your mosquito bite is. And I forgot what it does.
It helps take the itch away.
It helps take the itch away.
That's very cool.
Awesome, thank you.
Thank you for sharing that.
It makes like a pulling motion, and I'm pretty sure if you've been itching the mosquito bite a lot, then it hurts when you do it.
All right. I see that Imagine and Dragon have their hand up. So what? Do you have a question?
I already got the badge when I was doing Girl Scouts, so I don't really need to do the badge, but that was fun. I was happy to do it.
Awesome.
Thank you.
It's cool that you already have the badge. Star, what's...
One time, I had to go to the hospital because my daddy thought I had a broken toe, but I didn't. It was just that one of my brothers landed on it when I was really little.
Oh. Yeah, I've had to go to the emergency room before because I fainted 2 times. It is not fun at all.
How did you faint?
I have a health condition that causes me to faint and to get dizzy. And so that happened. And so because of that happening, I learned about this condition that I have. So, yeah. Does anyone have any questions about first aid? Hershey, do you have a question?
No, but a few weeks ago I got my tonsils out, and I'm taking all my medicine and I had to get an IV stuck 3 times. There's still a mark right here. And I have a big because of it right here.
How are you feeling about all that?
I'm feeling better because it was a couple of weeks ago and I went to the hospital 3 days ago because of it.
I want you to raise your hand if you have been to the emergency room before. Wow,
I have when I was a baby. To get myself out of my mommy's tummy.
That is true. We all have had that.
But not all of us have gone to the emergency room before that. Probably. Maybe. Because it might have accidentally happened at home.
All right. So.
Or in the car.
All right. So.
Miss Piggy, there's one thing in the chat that Pooh Bear wants Mozart to share that Pooh Bear had been to the emergency room a couple of times. She's broken arms twice and was sick and dehydrated one time.
I read that.
Yeah. Do you want to say anything else? Because it's now 12:13.
Nope. I have nothing else to share. Just to put the things back into your first aid kit. And to put it in a place that you will remember.
Thank you. Thank you.
Eat a healthy lunch.
Your presentation was fantastic.
I made my Girl Scout flag or sign thing. I finished it.
Awesome. We will share that tomorrow when we have our unit time.
You can show me
Cool.
really quick now if you want to.
Or you can show it really quick now.
Okay, because I'm still gonna make the thing to hold it with though.
Oh, I love
It's
it.
a copy of the American flag.
Awesome.
The sisterhood.
And I see sharks. That looks awesome, girls. Hershey, you have your hand up.
Yeah. Eating differently, so the hospital people were gonna kill me because they thought I was dying. So I almost died when I was born. Because my heart was differently.
Hershey, I'm so glad you were born healthy and that it all worked out in the end, because here you are at our camp. All right. Well,
Yeah.
I think that's enough
I don't
of
get
our
what
stories
happened.
to tell for
I
this.
don't get what happened about the about to be killed. I don't really get what happened because
Well, it just seems like maybe she was just at risk. She had a risk and they had to move really quickly to take care of her. So
all right.
let's
I'm gonna go and eat
you.
some lunch before I teach first aid for the older girls.
Wonderful.
I will see you all.
1 o'clock Pacific is our next session. I don't know if you'll see them though.
No, they will see me
They'll
at
compasses, yeah.
3 with Shamrock making the kite.
Wonderful.
Thank
Can I
you in the morning.
see you all then. Thank you, humans.
I will see you all soon. Goodbye.
Bye.
I think it was bye.
Who wants to say something to us?
I
Bye.
wanted to show my
Announcement.
Oh, Brave Bears. Was that you saying you wanted to show a poster real quick? Go ahead.
Yeah, it's not done. But my unit flag.
Oh, I love it.
And see up here it says
Rainbow
Rainbow Sunshine.
Great. Thank you. Thanks for sharing it. I'm going to hang up our room now. Say goodbye. Bye.
Bye.
Bye.